Hi everybody, welcome to AfriCent with BT. If you're new here, please hit that subscribe button, and if you like this video, hit like and share with everybody you know, everybody you think will need to hear what we're going to talk about today. We are going to talk about nursing and why nursing. I know like some young people who come to the diaspora, particularly the United States, you and of African descent, particularly Uganda. I'm from Uganda, so I refer a lot to Africa and Uganda. You're under pressure from your parents. You have to do nursing. And I know a couple of my friends who have been frustrated from that pressure. Why are my parents forcing me to do nursing, right? So I'm a nurse by profession, so that's a disclaimer. But I was lucky to have gone to school in Uganda. So I went to school in Uganda, Makerere University, did my 4 years of nursing, and then I had my 1 year of internship, so 5 years in total to get my bachelor's. And the nursing in Uganda is a dual degree, midwifery and a registered nurse combined. So, and unfortunately, most people who do the bachelor's degree in Uganda ended up doing administrative work or research and never really do clinical bedside nursing. But I was lucky that when I moved, if you haven't watched my video on how to convert your degree, your bachelor's degree, if you're from a foreign country to the American standards, just scrolling up in my channel and you find it, and it's very informative. Please make use of it. So for those of you who are wondering why nursing, I will tell you why. I mean, personally, so in Uganda, rewind. In Uganda, we have A levels where we do, which would be associate degree here. You finish high school 4 years, and then you do 2 years of A levels, and you get to study particular majors, what Americans would call majors, to kind of lead you to what you choose in the university. And then at university, when you, depending on what you applied for, they kind of multiply. There's a whole system. We'll do a whole video about that, so that those of you who are in Uganda and are thinking about how to strategize and what you should put your effort in, it's the final term, and you want to kind of have that final push to be ready to get in the course you want at university. We'll talk about that in another video. But today, why nursing? Yeah, so personally, I wanted to do medicine initially, right? I wanted to become a doctor. I wanted to actually become a pediatrician. I've worked with kids all my life. I teach Sunday school. Well, I used to. I need to go back. I need to plug in and teach Sunday school. I've taught Sunday school since I was 13, and now my Sunday school are my kids. My 2 kids are the kids I'm like pouring my whole heart out to, but I need to plug into my local church right now where I live. Yeah, so I wanted to be a pediatrician, and of course the school system in Uganda, I didn't do as well as I needed to do, and I ended up with a Bachelor of Science, a flat course, like my very last course. I'd even just filled it out just for the sake of it. A Bachelor of Science in Botany, Zoology, and Ecology, I think something like that. And I had just filled it out for the sake of it. And then that's what I ended up getting on government scholarship. So I was so devastated. And I remember both my parents were in the United States at that time. And I called them crying. And then my parents were like, just apply for private. So I said, okay, fine. So I applied for private. And even when you're applying for private at Makerere, you have to still choose options. So my first option was Makerere University Medicine, Mbarara University Medicine. Then I did Makerere University Nursing, Mbarara University Nursing, even for the application for the private placement. So, and there were only 3 spots for the nursing degree, I remember, because my class was quite small. We were just 12 of us in my class. Shouts out to that, my class 2004. So I remember I kept looking and waiting, and I did like my applications. I was lucky. I feel bad because I've had free education, right? A flat course, be a bachelor's in science, that kind of went to waste, because I don't know if somebody ever kind of filled that position, because I wasn't going to go for the flat course. I wasn't going to teach. There was no school that was going to take me to teach botany or zoology, although I love all that stuff. But so I ended up getting nursing, and I was so sad. I was like, I sort of put it there, but I did not want it. I wanted medicine, MBCHB, and now here I am, nursing Makerere. And so Makerere, then I don't know about now, and I need to find out, and I'll do a video about that. So Makerere, then you could do your bachelor's in nursing, because we do the first 2 years of fundamentals together, and then the last 2 years is when we really branch out and do more nursing courses. So more like the 2.5 years, because the pathologies, as we do pathology as well, and we do it together. So that degree in Makerere, you can actually go back and apply if you do it within the 5 years. Like finish nursing, go back and apply to do medicine, and you'll be given first priority to be placed in. And I have 2 friends of mine who have actually done it. One had done nursing, one had done radiology, and hopefully one of these days I'll have a chance to interview them, Dr. Joy and Dr. Nalongo. I will interview both of them one of these days, and you can kind of know that process. But so I said, okay, fine, I will come to Makerere and do my nursing and then go the medicine route, right? But it turns out I did my first 2 years, and it's amazing, like going to school in Makerere University, you're studying, like particularly my faculty, you're studying with the best of the best. Like my friends, like Elizabeth, Dr. Elizabeth, she's a dental surgeon. Dr. Nixon Nyozima, he's a doctor of doctor. He's an immunologist, and he works with a cancer institute. But these are friends of mine who are like, their names were in the newspapers from P7, S4, S6, like very smart. So you're in this space with the smartest minds in the whole country, and it can be quite intimidating. So it was such a privilege to be in such a space, because then you find yourself, and then you kind of make use of your peers, because they are teachers. They learn fast and they learn certain ways, and so they teach you how to learn. And the late Dr. Milton Manzi, I really appreciate you, because I know you're going to be with the Lord, but he taught me how to learn, and he understood my dyslexic mind. I remember I met him in Deje, and I was coming from Gaza High School. It was quite an experience. It was different. And he taught me how to learn. He said, Beatrice, you know everything. You just need to shelf it. Like your brain is like, it needs shelves. So you kind of categorize everything. And he is the teacher who taught me how to teach. So even right now, I volunteer and I teach students, like particularly Ugandan young women and men who are doing their prerequisites for nursing, who are preparing for NCLEX. I volunteer my time with that, and we'll do another video about that. So I honor people like him, Dr. Manzi Milton, the late. He taught me how to learn. He was my peer. He was, same class, but he taught me how to learn, and he taught me how to teach other people how to learn. But yeah, so when we started our clinical years, I fell in love. I fell in love with nursing, because I touched the patient. Like the physician, thought through the whole process, care plan, and they gave the orders, but I executed that orders, and I watched my patients, kind of come in very sick and recover and talk and laugh and eat, and for me that gave me so much job satisfaction. So I said, I'm born to do this. And then the fact that I'm sanguine, and I don't like the full responsibility of like, you're the ultimate decision, you know what I mean? So I kind of like that. Like I get to be a part of a team, but I don't have to make the ultimate decisions, which the physicians do. So it's a silly reason, but for me, it just worked out just well. So I stuck to nursing, and I did I moved to the United States of America, and I was just lucky that I was able to change my bachelor's degree to the American, did my NCLEX, and find that video below. But why nursing? And now that I remember Dr. Chiguli, she's a pediatrician, one of our heads in Makerere University, I asked her, I remember I know I'm ranting, but just keep with me, right? I remember we were doing this infectious control course unit for the 100th time. I'm like, Dr. Chiguli, I feel like this is a waste of my time and my money, because I'm a paying student, to do infectious control 1,000 times when I could be like learning more med-surg, because that's my passion. And she said, and then I was quite confused why we have to do everything. But she said something that was so profound. Every nation trains its people based on the needs of a nation, right? So in Uganda, as a nurse, I learned microbiology, I learned anatomy, I learned everything, that if I end up in a very remote place where I'm the only healthcare provider they have, I can see a patient based on their symptoms, diagnose, be able to look under a microscope and see those parasites, and be able to prescribe like the right medication, because that's the scope. Like they teach you, because they say, you know what, this is the only person we have, because like we said, the education in Uganda is a triangle. It gets narrower, fewer and fewer people end up at the top, you know, ultimately university. So they can't afford as a nation to just like under educate, if you get what I mean. So then I transitioned to America, where it's a very wealthy country and they have this luxury. We have, because I live here now and I'm American, we have the luxury of super specialization. Like we don't just specialize, right? I remember as a home health nurse, I went to one of my patients to see, they had just had cardiac surgery, and she's like, yeah, so there's this guy, there was a cardiologist came, opened up my heart, but then there was a cardiologist who specializes in the electricity, how that defibrillator in my heart works. Like, that is specialization, and then super specialization. You know what I mean? But I mean, the like right now, the growing, I live in Northern California, and the growing demographic age-wise is 80 and above. Like 80 and above. And if you come to my clinic, because my clinic has so many people who are above 65, when you're like 60, we're like, you're young. 70, you're young. Like, until you hit like 90, then we're like, okay. You know what I mean? But in Uganda, for someone to live up to 40, like right now we're at 50, and we're like, yeah, lifespan 50, we feel like we've gone ahead. 50 is nothing. You still have to see your children grow, and their children, and be able to support them and be able to contribute to our country economically. So we lose out as a country, but that's a story for another day. Coming back to why nursing. So coming here, I actually understand why it's amazing that I did nursing, because of that super specialization with a bachelor's in nursing. I have the opportunity to choose, do I remain a bedside nurse, right? Do I go into research? Do I go into administration? Do I go into that teaching, education? That sky is the limit. I know a friend of mine who is an engineer, Jennifer, shouts out to you, and she works for this amazing company that makes hemodialysis machines, but they have nurses who just basically do customer service. Like they sit and troubleshoot on the phone with the patients, like customer service. You pay to just be like RN rate, to just be a customer service person, just reassure patients, walk them through and troubleshoot. Like, do you understand that? If you choose to say, I want to stay a bedside nurse, right? Like touch patients, because for me, that's my passion. You can go into med-surg, you can go into psych, you can go into surgical, like where you assist in surgeries and prepare and all that. You can go in pediatrics, you can go in obstetrics, OBGYN. Like, even that is quite diverse. And I've had a privilege. So I've worked on a spine unit, and I've done hips and knees, abdomen and hips and knees, so surgical unit as well, a cardiac unit. Like, so even within med-surg, it's like, then you can super specialize. So you find some people have worked oncology and love it. Some people just do dialysis. Like, there's dialysis centers, and nurses show up and just do dialysis the whole day. So that ability to choose your niche, to find what you're good at and go and just thrive there. Like, there's no other profession that gives you that much diversity. The other thing about nursing is you choose your schedule. I worked nights for 8 years, and that was not good. Don't do it. But I had my personal reasons why that schedule worked for me at that time. And now that I have children, I work 8 to 5. In fact, now I do case management. I don't even do bedside nursing anymore. Like, I love my job, first of all. I really do, because my job has a little bit of everything. I get to touch my patients. I get to do occasional wound care. I get to do home visits sometimes. So, and then I case manage mainly. But I do 8 to 5. Like, that's my job, 8 to 5. 8 to 5. And which profession do you know is open 24/7, right? 365 days a week, or 366 if you have that leap year, except nursing. So for me, I feel like it is such a strategic career to go into. If your passion is people and helping and service, that's important, because we have some people who go in for the money, and that's the other reason. you're sure of a job, you're sure of a good pay, and also location. Like you could choose to do, like I said, home visit. You could choose to travel, and I'll do different videos about home visiting, life as a home visiting nurse, and I'll also do a video on travel nursing. I have a sister-in-law of mine who has just done travel nursing, and my sister Vanessa too. She has really been a traveler most of her career as a nurse. So that's an option too. Like you choose to work 8 weeks in 6 months, 8 weeks in 6 months, and live in any other country that you want to live. I don't know any other profession that gives you that, but it's just that sure, like every time there's a downturn in the economy, you always have a job. You can work for a hospital, you can work for a SNF, you can work for a care home, you can work anywhere. Like you choose, you figure it out, you figure out what works for you, and you choose. And the good thing is, if you plan to then eventually go into medicine like I had initially, there's a pathway. You already have half of the prerequisites. And I remember when I was orienting with my hospital, we had one of the nurses, he was going to be young man, he was going to be an intensive, he was being hired to be on ICU, and while we were like during our break time, he was reading for the MCAT. So basically this young man did his bachelor's in nursing, has ended up in a very good hospital. He's young, like he was really younger than me, and now he's studying his MCAT so he can do medicine. And ICU is one of the most highly paid departments. Like I advise, if you are almost done, if you can get a placement in ICU, like deep down in the village. I live in the village, but like deep down in a smaller space, and you get your ICU place and then transfer to a bigger hospital, you will really, so that your career kind of takes that path. I highly advise that. So, and now my sister Shamim, she practices in Britain, and she's now transitioning to anesthesiology. So I'm like, I keep speaking to all like different friends of mine, my relatives, and it can't get any more diverse than this. So for me, I really, and if you're, let's say management, say if you say eventually you want to do management, they would rather hire somebody to manage like a unit. If you've done your master's in business administration, you do your undergrad in nursing, and then you do your master's in business administration, like a hospital or an entity would rather hire someone who has a nursing degree, like that background, to manage a healthcare center. You know what I mean? So your chances, even when you choose to do, as someone who did maybe political science and did a master's in business administration, you compete, because it's about like the market, right? You compete really favorably well. So well, let me know what you think. And I do encourage, I mean, my sister is a lawyer by profession. I have a pharmacologist for a brother, a computer scientist. Like my whole family, they are in, like, everybody has their own route they've taken. But I'll speak for nursing. And if you have another profession that you want to talk about, please comment below if you have more pros or cons. And that's something else we will talk about. Like, okay, now you've chosen nursing, what next? That will be our next video. But hit me down below in the comments and let me know what you think. If you have any questions, please ask. I'll be more than happy to respond and to support you guys. All right, talk to you soon. God bless. Bye bye.